Good morning all, it's John Fangman, your Senior Medical Director for Ambulatory at Fairhaven Medical College. We wanted to provide a basic introduction to virtual care and especially video visits for the clinician, really optimize what is an exciting new part of our care model. I would start by reminding you that patients are really looking for a professional experience, and one of the things that I would say is what creates an environment that makes them feel comfortable. And one of the things that starts with is an emphasis on safety, because patients are, when they're projecting themselves over the ether, they really need to be reassured that this is a secure way of communicating and that it's a conversation just like a conversation would happen in an exam room with the door shut. So really creating a basic assumption that this is a conversation between two sets of people. It's like in the exam room, you wouldn't be having people coming in and out. Make sure the environment is controlled, whether that be from home or your office or when you're doing video visits from in the clinic. I would also remind you that people are looking at you and looking at the background and what your environment is. So be aware of the environment around you. You know, some people like having books to show how smart you are in the environment, or diplomas and degrees. But you know, if you're going to move between different environments, make sure you know how those environments appear externally. I would remind you there's an element of privacy about that as well. Do you want people seeing your family members or identifiable information that could be compromising anyway? So be aware of controlling the environment. I would also be aware of how you look. I'm not somebody who does a lot of video chat with family, and so I'm getting used to the idea of looking at a screen. And it starts with positioning. How close am I to the screen? We really would like to say about 2 feet typically. Make sure you're trying to maintain eye contact with the person. That means looking at the camera itself. When you are going to toggle between things, make sure you're noting that to people. I've turned to the side to look at some papers or look at another screen with some information on it, so that the person knows you're not distracted in the environment. That's obvious when you're in an exam room, but it's not so obvious when you're doing it this way. Also be aware of where you are physically positioned. You know, looking off to the side, looking up, and being positioned like this or like this is really problematic. So be aware of how you're moving around the environment. Finally, be aware of lighting. And we're just going to do a little demonstration here as I walk around this room in the hub. And I go from a wall to a window, and you can see John just gradually disappears. So be aware of that. They want to see your face, they want to interact with you, they want to know they're connecting with you, even if they're not with you. So be aware of some of these basic issues that will set you up for really connective, satisfying experiences for both you and your patients. Thanks. And virtual care provides a whole new perspective on work from home, allowing us to be in more comfortable clothing, in more unusual environments, like my backyard. But remember, that might not be what a patient's looking for when they're trying to interact with you as a health professional. No, no, no. And virtual care provides a whole new perspective on work from home, including allowing us to think about working from my backyard or working in my Saturday clothes. But remember, that might not be the experience the patient's looking for. And be aware of the acoustics of the room you're doing your video visits in. Small rooms can lead to reverberation and echo, and ambient noise in the environment can be quite distracting for patients.